Let's look at a movement preparation program designed specifically for your client. So what we'll begin with is looking at the overhead squat assessment. So we'll ask Claire to first of all align her 5 kinetic chain checkpoints. We want to be sure the feet are approximately hip width apart, toes pointing straight ahead. The knees are going to be aligned with the second and third toe. Hips are going to be neutral. Go ahead and reach both of the hands all the way overhead. So to begin here, we're going to look at the anterior view. And with the anterior view, we're looking specifically at the feet and the knees. So as soon as you're ready, go ahead and squat to about the height of a normal chair. And we're going to repeat maybe 5 repetitions. So as she lowers down, we can begin to see the feet are turning out, knees are coming in, toes are also starting to come up. We'll go ahead and just have her do one more. And you can go ahead and relax. We can clearly see those compensations, so what we'll do now is go ahead and move on to our program. We know that if the feet turn out and the knees come in, our calves are going to be overactive, as well as the adductors. So let's go ahead and foam roll those. So we'll grab our foam roller, go ahead and take a seat on the ground, position the roller here with the foot right in the center. The opposite leg will come over top for extra compression. If for any reason you need to reduce the compression, if it's too painful, you can uncross the leg here. Now we'll raise the hips and we'll slowly begin to roll towards the knee. Remember, about 1 inch per second, keeping the foot relaxed. You can set the hips down there and reposition the hands. When you find a tender spot, something that you identify as tender, you're going to stop and hold. We're going to hold this position for 20 to 30 seconds or until the tenderness starts to reduce, so be sure you breathe, try to relax the muscle. You can go ahead and relax there. What you would do is perform that on the other side. Now we're going to move on to the adductor. So we'll position the foam roller here. You'll go into a face down position, or prone position. The legs positioned in the center of the roller, there on the adductor. Elbows are in front of the body, right below the shoulders, maintaining the compression here on this side. Now again, a nice slow roll towards the midline of the body, so you'll slowly start to roll your body out. Whenever you find that most tender spot, you're going to stop and hold. Remember, just maintain the compression. Be sure you're breathing. Big, deep breaths allows the body to relax. Hold that for 20 to 30 seconds, and then you would repeat on the other side. Now we're going to move into our static stretch. We'll begin by statically stretching the calf, the same areas we foam rolled. So from here, just go into a staggered stance position. We'll focus again on our kinetic chain checkpoints. So here we'll slightly internally rotate. We'll engage the quadricep, engage the glutes, keep a neutral position here with the spine. Now by bending that right knee, slowly go to where you reach that first point of tension, and then you're going to hold for 20 to 30 seconds. And remember, a static stretch is not supposed to hurt. There may be some discomfort at that end range, but it should not be painful. After that 30 seconds, you would repeat the same thing on the other side. Now what we'll do is go to our adductor stretch. So here, feet nice and straight. We'll go into a wide stance. She's stretching her left side adductor. So this right foot's going to be positioned slightly in the front. Right heel is aligned with the left toe. Again, she will contract the quadricep on that side. Hands on the hips. Tuck the butt underneath as you engage the glute. Then from here, we're going to bend the right knee. She's lengthening that left adductor. Take to the first point of tension, and then you're going to stop and hold. And again, there may be some discomfort, but we don't want pain. After that 30 seconds, you would repeat the same thing on the other side. Now, following along with the OPT model, we're going to go into our core, balance, and reactive. And this is really where we get into that movement prep. So what we'll begin with is a floor bridge. We know if the feet turn out and the knees go in, the glutes are probably not doing their job. We'll go into a supine position. Hands are going to be to the sides with the palms rotated up. That allows us to relax the shoulders. 5 kinetic chain checkpoints, so feet, knees, and hips are all in alignment. Neutral position with the spine, neutral position with the shoulders. So I'll ask Claire to go ahead and slide her feet a little bit closer to her hips. Now from here, while maintaining equal pressure across the foot, let's lift the hips for about a second, following our 4-2-1 tempo. We'll hold for 1, 2, And now we have a 4-second eccentric. So lower for 4, 3. Notice how she maintains a neutral position here with the spine. 2, 1, and we'll drive back up. Contract the glutes at the top. Hold for 1, 2, down for 4, 3, a little bit faster on the way down. 2, 1, and drive up. Contract the glutes. Hold for 1, 2, down for 4, 3, 2, 1. If for any reason you're feeling too much in the quad, you can extend your legs out slightly, and you can repeat there. If you begin to feel too much in the hamstring, then you can simply slide the foot back closer, and you would repeat that for 12 to 20 reps. Now we're going to move into a side plank. So keep in mind those knees caved in, so now we're going to engage that lateral side of the body. So we'll go into a side plank position. So elbow is going to be beneath the shoulder. Notice how her ankles, knees, and hips are stacked. She's going to contract the quads, squeeze the glutes, keep the abdominals here engaged. We're focusing on core stabilization, and we would maintain this position for about 20 seconds. You can go ahead and relax there, and you would repeat on the other side. Now we're moving from core stabilization to balance stabilization. So let's go ahead and stand. Whenever we do balance, we're trying to focus on the client's balance threshold. So to begin, what I'll ask Claire to do is put her hands on her hips, 5 kinetic chain checkpoints, feet are straight, knees are in alignment, hips are neutral, shoulders are relaxed, and head is positioned appropriately. Now I want you to shift your weight to your left leg and just barely pick the right foot off the ground. Our focus here is the stabilization leg. We want to be sure that she's maintaining a neutral position in the arch. Now remember, I said balance threshold. If this is too easy for her, what I'm going to ask her to do is drop down to about 1/3 of a squat. Right there, perfect. And we'll notice that's a little bit more challenging for her. So I'm going to have her hold this position for 20 seconds. You can go ahead and relax there. You would repeat on the other leg. Now we'll move on to our reactive stabilization. Here we're focusing on landing mechanics. We're not trying to get you to jump super high. We want to be sure that your landing is perfect. So let's begin again with those 5 kinetic chain checkpoints. Everything's nice and straight. Whenever you land, you're going to hold for 3 to 5 seconds. This gives you an opportunity to tell your nervous system where you want things to go. So if you land with your feet out, you just bring your feet in to where they're nice and straight, hold that position, and then jump again. So let's begin by coming down into a slight squat. While using the hands, go ahead and jump. Perfect, land. Let's look at the feet. Very good job. Notice how she pulled them in straight. The knees there are properly aligned. And let's repeat, let's jump. Very good, let's take a look at the feet. Realign them. So here you're telling the nervous system, this is the position I need you to land in. And let's go again. Perfect, you can go ahead and relax there. You would repeat that 8 to 10 times. And that gives you your movement prep. We did the foam rolling, we did the static stretching, we did some core activation, some balance, and some reactive training. So from here, you can either repeat that up to 3 times, or you can move right into the resistance portion.